Good afternoon. I'm Matt Westerhold with StaysTunedSandusky.com, and I'm here at the Erie County Health Department with Health Commissioner Pete Schade. Pete, hello.
Hi, how are you?
I wanted to come out here because I learned about this new directive from the Health and Human Services, the federal government, a reversal of a long-standing policy to serve everyone.
Right.
Can you talk about what that means for our community?
Well, at this point, we're very concerned here at the health department on behalf of everybody in our community and all communities across the nation. This new edict we received on Friday basically says you are not allowed to provide any care or any service for, I'm going to use their words, any illegal aliens who may come into your facility for care if you receive any federal funding. So the list of people or places that this includes are things like community health centers, community-based mental health care clinics, substance use and disorder facilities. Head Start is actually the first agency that they list. So at this point in time, what we're trying to do here is draw attention to this Federal Register notice that we received on Friday, because it doesn't seem like a whole lot of folks know about this, and it's been very quiet. It hasn't made the news, but with you being here today, we're hoping that enough people can see this and understand they've got to make some noise. There's a 30-day comment period associated with this new plan, and it seems to us here that we're looking at maybe 700 to 800 people just off the top of our head that this might disqualify for help, whether it's services, whether it's from our community health center, primary care, dental care, mental health care, substance use disorder care, or any of our health department services like WIC, Women, Infant, and Children's Services, or our lead program, what we do with lead. So this is an outrage at this point.
And this is from Health and Human Services Secretary Robert F. Kennedy.
That's correct.
Junior. And right now the practice at the health department and at family health clinics like this is you don't ask them to prove they're an American.
No, we don't. And there's a simple reason we don't do that. And the reason is everything we do is predicated on the health of the general population. So we provide care for people here that, let's just be honest, it's pennies on the dollar, right? If we can give them some care, they're going to be a safer individual out in our community. And what I mean by that is the chance that they're going to spread an infectious or communicable disease to someone in our community is mitigated quite heavily by coming here for some rudimentary care.
So this is a small investment for public health.
Yes, absolutely.
For the better services to the entire community.
Correct.
Is what you're saying.
Correct.
Did you ever expect this? Did you ever think this would happen? I mean, you've been in public health your entire career. How shocking is this? How disturbing is it?
So, if this was the only thing that happened in my career, this would still be the number one issue that I never saw come in and just don't agree with. There's been other issues by the federal government and the state government that we were able to work out and had some hybridized strategy that we could still continue to do things going down the road. But this particular information we received on Friday, July, what was the
10th?
10th or 11th, is devastating. And here you are on Monday, the first day back from the weekend, and we're trying to figure out, how do we tell the people that are coming into our facility, how's Head Start going to, how's rural community
Head Start being early education for children.
Right. I mean,
WIC being nutrition for families.
Right, which we have here as well. We have a big WIC clinic in Norwalk. We have another WIC clinic in Vermilion. And we serve a lot of people, again, as an effort to keep folks safe and healthy. And I think most people, I think almost everybody in Erie County and who might be listening to this understands that concept. The bigger picture that they're painting, they being Health and Human Services through Kennedy Jr., is we don't want taxpayer money going to undocumented illegal aliens for care.
Is that hyperbole? Is that overstatement?
It's in writing.
Mean by them, making the statement, we don't want money going to illegal aliens.
Right. We don't want our U.S.
First
taxpayer...
off, it dehumanizes the person who needs care. It makes their legal status what matters.
Right.
But you also, I think you mentioned to me earlier that there's a conflict between what the state requires and what the federal government is now mandating.
Right.
The state requires that you treat anyone regardless of ability to pay.
Correct.
The federal government is now saying, but don't use any of our facilities or our grant money. Mm-hmm. So is this? How concerned are you?
I'm waiting for a call back from the Ohio Department of Health assistant director, and I know he's swamped today because of this. And I'm waiting on a call back from a congressional aide to talk to them about what are the expectations that the U.S. government and the state government have for places like the Erie County Community Health Center and the Erie County Health Department. Is it today, do you want to sign out front notifying people if you're not here legally, turn around and leave? Because if that's what we need to do, that's what we're going to do, because the fulcrum that they have with us is our funding. If we don't abide by this federal notice, I guess immediately, like it says, they can take our federal funding away.
And then they would take that away from all of us.
Well, they would have to. Now, I'm sure the majority of this new policy, this new protocol, is geared towards the LAs, the Chicagos, the bigger cities where there's a lot of other issues going on. And I'm not going to get into that. But this affects Sandusky, Ohio.
And I don't mean to interrupt you, but so you have a sign out front of the health department that says, if you're an illegal alien, don't bother coming to us for help. That person is not going to get help. Right. And your fear is that if there's a communicable disease or there's the spread of disease because a person doesn't get treated,
right.
It's return on investment. Right. So it's a small investment to treat human beings to protect the public at large.
That's exactly,
is that right?
That's very well put. So, I mean, we could use tuberculosis as an example. It's nothing to mess around with, right? We've been dealing with it for hundreds of years. If we have a person with active tuberculosis and they're not being treated every day, we have to treat these people every day. It's called daily observed therapy. Mm-hmm. If we don't do that, the chance that they spread that tuberculosis amongst the community is very great, because it's salival driven, right? This isn't made up. This isn't an alarm bell that I'm sounding. This is fact. And if we can take a person who might be susceptible or might have TB and get them taken care of, whether they're in this country legally or not, that's going to help save the lives and save the money of our communities, right? That's going to save millions of dollars, because if we have a TB outbreak, and I'm just talking one disease, I'm just talking TB, there's a whole host of other diseases.
Measles, for example.
Measles. If we can prevent the outbreak, that's millions of dollars we're saving.
And again,
this productivity.
This is the investment in public health has a return on investment. Right. I mean, you have a return.
And clearly, I was going to say the Ohio Department of Health understands that perfectly. That's why ODH is our mothership, right? And we follow their commands. Because
they want you to treat anyone, regardless of ability to pay. They don't distinguish between citizens and non-citizens, aliens, illegal, unlawful, whatever they want, whatever term they want to use. Are you surprised this is happening, or were you fearing the administration would do this?
I'm really surprised that it's happening, because although I don't agree with a lot of shots we've taken, right? We've gotten punched with federal funding getting cut, and this these programs getting.
Well, you're
axed.
expecting substantial cuts next year in your annual budget.
Right, about $5 million.
About $5 million, which is what, 20% of your annual budget. So
sure.
already the administration has caused public health to be de-emphasized, to diminish the investment in public health, which you would contend for every dollar invested, there's a return on that
absolutely.
dollar.
We've all heard those, those comparisons, right? I don't have a number to say every dollar in public health, what's it worth, because all I know is a typical outbreak can cost millions of dollars, right? And that's just not in the forever diminishing health of the people involved in it. It's the economic impact as well. But what I wanted to say to answer your question, was I surprised? It was, because I thought the team the administration has was smart enough to realize what public health means to this country, why public health was ever established in this country back in 1770, whenever it was, at the Naval Army Barracks during the Revolutionary Wars, when public health was established in this country.
So it's part of our nation.
Yeah.
It's part of our. It's like journalism.
And they talk about patriotism, and they talk about American values. This is a gutting of an American value that we've had that has kept us in a first world status as long as we've been here. And I don't want to be an alarmist.
Well,
it's going to degrade our society.
And Sandusky's been the site of epidemics, the cholera epidemic.
Right down the street.
The cemetery you're talking about.
Right down the road.
Where hundreds of residents died in 2 different outbreaks of cholera, I think.
That's correct.
You weren't the director then, were you?
No, 1849, I wasn't here yet.
What do you want? What do you want people viewing this? What do you want them to do?
I want people to understand. Please look at your information on your site, and please look at the link. Go to it and read it yourself.
At my website.
Your website.
StayTunedSandusky.com or StayTunedSandusky.com.
Because you'll have that link, those couple links on
there. Oh, yeah.
Because the full press release is on there. I'm not saying anything that is made up.
The full press release from Robert Kennedy Jr.
Yeah, from Health and Human Services.
Well, let me ask you. So I think what you're telling me is you don't have confidence in Washington to be making the right decisions right now. They're not making the right decisions.
No, they're not. They're predicating their decisions on gaining more support from people who may not understand the impact that they're going to have. In other words, by saying we're not going to have American taxpayers have their money spent to take care of these people who are here illegally, they should be telling the truer story. They should be saying, well, some of your taxpayer money has to go towards taking care of everybody who's in our kettle. That's what they should be saying. So they're not standing up for those principles that, again, were started here prior to the Constitution.
And should people call Senator Marino, Senator Husted?
I would definitely think
so
they should.
We'll put those numbers in our news story about this.
So one other thing, I'm sorry to interrupt. We're still waiting on guidance for this.
Right.
So the issue at hand is we received this information Friday, and it says you must implement this immediately. More guidance to follow, much like your story carried for JFS, right? JFS has been told to do certain things, do this, you got to do this, you got to do that, but there's no guidance.
Right.
So, I just don't want to cut off seizure medication for someone, or stop seeing a pregnant lady for her prenatal care, or dealing with a mom with a couple kids who are using the WIC program just because right now we're told to, without any substantive guidance behind it. What do they do? This isn't America. This is not the country I know. I'm 61 years old.
Well, thank you for giving us this update, Mr. Schade. I certainly appreciate this, and there'll be a news story at StayTunedSandusky.com, and we'll follow up with you as you get more guidance. We'll also, Marino and Houston have not responded to numerous requests about their votes in favor of these cuts. Well, not these particular cuts, but other cuts, the Medicaid cuts. Let me ask you one last question. How might this impact Firelands Hospital?
Well, other entities in and around Erie County, whether they receive direct federal funding or apply for federal funding, are going to be affected. So there's another health center that's going to be affected. The hospital, I think, what they have to do is really line up the services they provide, like in the ER. What are they able to do in the ER if someone is not a quote, this documented citizen? Do they turn the person away from the ER?
Which is not what a hospital does. I mean,
but I don't know the answer to it. So
they're really putting them in a position to go against their mission.
Well, they're already being whacked by some of the funding constraints that have happened. It's no secret the rural hospitals are a target for the administration to get rid of them. And
why would the federal government want to get rid of rural hospitals?
Well, I think when we look at the generation that is coming in terms of hospital, I'm losing my train of thought on the words, but the hospital systems. Okay, so in Ohio, traditionally we had about 80 hospital systems.
Across the state.
Right, they being primarily the federal government, they want to shrink that down to 8 to 10 hospital systems.
Wow.
Because it's less checks they have to write, it's less administrative costs, is it more efficient? I don't know. Ask somebody who lives out on the other side of Clyde if it's more efficient to not have the Bellevue Hospital where they can go to, which thank God Firelands was able to pull out of the fire.
I guess.
But if the funding's not going to be there, it's all for naught.
Yeah. And I guess the question is, if you turn them away here, where it's on a sliding scale of your ability to pay, and they have to see a doctor, then they're going to Firelands.
Right. They'll go to the ER, which is the most expensive form of care, which is going to
So it's short-sighted.
10 times add to the cost of care for these folks if they're going to see them, if they're allowed to see them. I don't know if they're allowed to do that because the funding they're going to ask for to see that patient who's penniless comes from the federal government. So this is a real sticky situation. We got to figure this out.
And we're gonna continue this news coverage. And I want to thank you again for being on Between the Lines and alerting the community. And as you learn more, we provide us updates.
I will.
All right.
To see how much time you got left.
We're out of time. We went much longer than what we thought. But I think we'll be able to. The problem that I've been having is uploading the video kind of takes a long time if you go over 10 minutes, but I think I found a way to do that. Okay. This is StayTunedSandusky.com. Do you have a name suggestion for this video program, Mr. Schade? It used to be called Between the Lines. Should I keep that name?
I would keep that name.
All right, I will, because you told me to. Thank you for being with us. Be sure to check back at StayTunedSandusky.com daily, because we provide the news without fear or favor.